Understanding the transcriptome is really important if we're going to make progress with multiple myeloma. And so what is the transcriptome? So you have the nucleus with the DNA in it, and everybody talks about DNA mutations, but actually a lot of the DNA isn't turned into a protein. And so if you study the RNA, which links the nucleus with the protein, you can learn lots about multiple myeloma. So the real action in understanding and treating myeloma is taking the RNA, combining it with the DNA and the protein, and then understanding biology and targeting treatment to the biology rather than at mutations. So at one level, we did a study looking at mutationally targeted therapy, and because not all of the cells carry the same mutations, all that happens is like you prune the tree, you don't kill it. So at some level you have to go for the roots. And so you can define the mutations and the expression pattern that define the roots of the tree and then target your therapy at those features. And so we're making a lot of progress with that. And so you can use the transcriptome to see if myeloma is going to behave quietly and gently, or whether it's going to be more aggressive. And so you can put the mutations together with the RNA and do what we call risk stratification. And so if you risk stratify myeloma like that, it can be 11 to 15% of newly diagnosed, and each time you relapse, more and more people become higher risk. And so that way we did this very clever analysis where you looked at the master regulators which control all of those RNA species, and now we can design therapies that go after those features. And so it's teaching us a lot about myeloma, how to treat myeloma, and where the future lies really, which is personalizing therapy based on understanding the biology of the disease. And we're making a lot of progress with that. Like these are amazing times like for patients. And so if we want to understand what's happening at a cellular level for myeloma, you have to look at single cells. And so what you can do now is take the whole bone marrow and do single cell RNA-seq on them. So that is where you get all of the species that define that cell are sequenced. So that doesn't sound very interesting, but what you realize is you can look not just at the malignant cells, but you can look at the different compartments of the bone marrow that react to those malignant cells. So at some level there are like 17 different types of mesenchymal stem cell populations. Each one of those could be positively and negatively controlling the myeloma. And so if you can get a snapshot of those cells and how they change and react to the myeloma, you can find new targets that really would allow you to, like, say, use some type of therapy to put you into a remission, and then by understanding the biology, have gentle, non-toxic treatment that keeps people alive and well for the long term. And the other place you can use it, of course, is for people with monoclonal gammopathy of uncertain significance or smoldering myeloma, which are basically pre-malignant, and you don't really want to be using chemotherapy in those populations. So manipulating the microenvironment to stop them ever turning into myeloma. And these sort of interception strategies are really becoming the shape of the future. In terms of examples of treatments which may target the microenvironment, we've seen things like Treg cells are important, and already those are manipulated by daratumumab. Hepatocyte growth factor seems to be an important feature, IL-6 receptor. And so we understand a lot about how the tumour cells are talking to one another. But up until now, there's been no kind of slam dunk treatment, and that's because we simply didn't understand enough. And these new technologies will allow us to take it to that next level of understanding.